All right, so let's start with the big story that we are tracking on WION this hour, where the top Republicans in the United States are heading out at New York's Governor Andrew Cuomo for undercounting the COVID-19 deaths at a New York nursing homes. The last month, Cuomo's administration had confirmed that thousands more nursing home residents had actually died because of the coronavirus than what was officially put out in the state's tally. For months, the state had downplayed the true numbers after several reports. At least about 12,743 long-term care residents are said to have died because of the virus, which is way greater than the official tally of 8,677. The surprise development comes after a report by the State Attorney General, Letitia James, found that the death count could actually be less than 50% of the number of deaths that actually took place due to COVID-19. This means that the true death toll of New York nursing home residents is at least about 13,000. According to new records obtained by the Associated Press, more than 9,000 recovering virus patients in New York were released from hospitals into nursing homes at the height of the pandemic. This was done under a controversial order by Andrew Cuomo last year. Now, Cuomo's 25th of March directive required nursing homes to take recovering COVID-19 patients. It intended to free up space in hospitals that were swamped in the early days of the pandemic. The directive was scrapped amidst criticisms that outbreaks were accelerated due to the same. The Cuomo has reversed the directive on the 10th of May and barred nursing homes from accepting COVID-19 patients without a negative test first. This, of course, has raised new questions as to whether Andrew Cuomo's directive had helped spread the sickness and deaths amongst the residents. But his administration has disputed the charge. Critics have suggested that many other places those patients could have been sent to, including New York City's makeshift hospital and also the U.S.'s Comfort Military Hospital. The state has contended that those facilities were not suitable for such patients.
The 9,000 patients transferred, that's 40% higher than we had previously known. It's important because these patients with COVID were sent to places that house the most vulnerable, the most frail population of the state. And indeed, in subsequent months, we now know that nearly 15,000 nursing home residents died from COVID. The question is, given the new numbers, does this cast the New York State's response to the pandemic in a negative light?
When asked about the issue, Andrew Cuomo said that the state was only following federal guidelines when it tabulated the number of COVID nursing home deaths.
The Cuomo administration says, no way. We've already looked into this. The patients that were released from hospitals and sent to nursing homes were at the hospitals long enough that there was very little chance that once released, the virus was still active and could infect residents in their new homes, in these nursing homes.
Andrew Cuomo has repeatedly downplayed criticism of his administration's handling of nursing homes as a politically motivated blame game, while he has also managed to write a book about his leadership in the virus crisis. Now, according to reports, Cuomo's top aide has admitted to hiding the state's coronavirus death toll in nursing homes out of fear of political doom. The Secretary to Governor, Melissa DeRosa, has also reportedly apologized for the same. Overall, New York has lost over 45,000 people to the virus, which is more than every other state except the state of California.